I'm Dennis St. Martin. I am one of the co-founders at Pompe Warrior Foundation, and I am here with Dr. Marc Patterson, pediatric neurologist here at the Mayo Clinic, and he is Leo, our son's neurologist here at the Mayo Clinic. And Dr. Patterson has been kind enough to do this interview with us and answer some questions about Pompe or Pompe and the ketogenic diet as well. Dr. Patterson, I was wondering if you could give us a little background on lysosomal storage diseases and your experiences.
Sure. Well, my involvement started almost 30 years ago when I was a fellow at the National Institutes of Health with the late Roscoe Brady. I would think many people have heard of Roscoe. He worked until a few weeks before his death at 92 on lysosomal diseases.
Wow.
He actually discovered the enzyme defect in Gaucher disease, Niemann-Pick diseases, Fabry disease, just got beaten on Tay-Sachs disease, and went on to develop the first effective enzyme replacement therapy, which was for Gaucher disease, subsequently did the work on Fabry disease. So I was very privileged to work with him and to really begin my involvement with lysosomal diseases.
So not only lysosomal diseases, but the enzyme replacement, really the birthplace of what we use right now.
Yeah. That was a very exciting time. Lysosomal diseases are a big family, depending on how you count them. There are 60 or 70 disorders, and it turns out that Pompe disease is the first lysosomal storage disease. The lysosome was actually discovered in the 1950s by George Pallard and other scientists, and they won the Nobel Prize for this work. Before that, scientists thought that the cell was really just a membrane with a nucleus and a big soup where all the enzymes floated around. But as a result of this work, they learned that there are smaller structures within the cell, including the lysosomes, which are very specialized and which enable the enzymes to function most efficiently. And it turns out that of the many functions of the lysosome, one is to be a recycling center for the cell. So as big molecules come to the end of their useful life, they are broken down and recycled within the cell, and this happens in the lysosome.
Okay.
Now, if it turns out that if the relevant enzyme isn't functioning properly, these big molecules don't get broken down and they accumulate within the lysosome. And this concept of a lysosomal storage disease first came about a little over 50 years ago when a physician called Heers, working in Belgium, studied Pompe disease and said, this is a lysosomal storage disease, and by that we mean it's a disorder in which the large molecule, the substrate, builds up in the lysosome because there's not enough enzyme activity. So Pompe is technically the first lysosomal storage disease.
Well, that's good to know, because I know most people categorize it as a glycogen storage disease.
Right.
It is both.
It is both. It is both.
But it is much more so, at least I believe, a lysosomal disease.
I think it's important to think of it as a lysosomal disease because of the influence that has on the approach to treating it.
Yes, and the approach to treating it leads us into why we are here with you and at the Mayo Clinic. And what do you think that we are doing that helps Pompe, and what we could do better?
Right.
Yes.
Well, enzyme replacement, of course, the work on that in Pompe disease started in the 1990s. That's been a very slow but important process, because prior to that, infantile Pompe disease was essentially a uniformly fatal illness. So we know that enzyme replacement therapy has transformed that. It's been a tremendous development, but it doesn't do everything we want.
There are some limitations.
There are limitations, and we know, for example, that one of the problems in Pompe disease and some other lysosomal diseases is that autophagy, which is the process in lysosomes that involves recycling other organelles within the cell, doesn't work properly. And the result is we don't get complete breakdown of the accumulated substrate, the cell doesn't function normally, and we can still have continuing problems with heart disease, with muscle problems, and we suspect in some cases with malfunction in the central nervous system, which is not always thought of Pompe disease.
So the buildup of all of these other molecules, biomolecules in the cell, hinder the ERT from entering the cell and doing its job? A layman's way of saying it?
Yeah, it actually hinders the function of the lysosome as the recycling center. If you can imagine you're at the recycling center and there's a blockage with the trucks coming in or out, then you can't get rid of this stuff.
Okay.
And you don't want a build-up of it because it's not good for the cell.
Right.
And it actually interferes with signaling in the cell, with division, and it ultimately can kill the cell.
Okay.
So it needs to be addressed. And so the reason we're here together is because, of an insight you've had yourself and other scientists have had in the past, and that is, well, could we possibly use diet to supplement what's done with enzyme replacement therapy?
Yeah.
Because one of the problems with the storage of glycogen is that the glucose supply in the body is going to be limited if we can't break down glycogen, so it can mean we don't have enough of that essential fuel. Well, one approach is to say, we have an alternate fuel. If we don't break down glycogen, we can supply fuel in the form of ketone bodies, which are produced by burning fat. And
Right.
it happens that at Mayo Clinic, we have a lot of experience over
Close to 100 years.
close to 100
Yeah.
years with the ketogenic diet. In fact, the term was invented here. Now, we didn't invent the idea of fasting. That's been used to treat seizures since biblical times. But it's been formalized and studied carefully. That's been the main use of the ketogenic diet, is to treat certain types of intractable seizures. But it's also very clear there are other disorders where there's a problem supplying body fuel where we need an alternate because we don't have ready access to glucose.
Right.
So, for example, some patients have a deficiency in the transporter that brings glucose into the spinal fluid from the blood supply. The ketogenic diet has proven to be very effective there.
Okay.
People have looked at dietary treatment in various ways for Pompe disease and other glycogen storage diseases for a long time. So, our hypothesis is that maybe we can help Pompe disease by supplying an alternate fuel in the form of ketone bodies and also suppressing that need to try to mobilize glycogen.
Right. Because if you switch over to a ketone as your main fuel source, you no longer need glucose at the same level where you would produce glycogen.
Exactly.
So you essentially are taking away fuel to your problem.
Right.
Right. Okay.
That's exactly right.
All right. Well, doctor, I don't know if there's anything else I have to ask you. I don't know if there's anything else you want to add, other than we are working on the ketogenic diet as a compilation with ERT. Right? It's
Yes,
not,
I think we're not
saying
wanting
one
to
is-
supplant ERT.
Yes, no, we
ERT
need
is absolutely the cornerstone. It's been very thoroughly studied in Pompe disease, but everybody in the field is aware of the fact that it's not the whole answer.
Yeah.
And there are other opportunities, other approaches being explored, including chaperone therapy. But in the meantime, we have ready access to the ketogenic diet. We're very lucky here that we have a team of dietitians and others who are very experienced using it. And so we think it's very reasonable to try that approach. And what we're doing together is working out the best way to implement that and to measure the outcomes.
Right.
So I'm very excited by the opportunity.
So are we.
We're feeling very positive about this.
I have one question came to mind, and it's on the autophagy side of things, the buildup of all the biomolecules in the cell. One thing that I know you and I have talked about before, being ketogenic changes the hormones in your body, and it changes one hormone called mTOR. It downregulates mTOR and it upregulates TFAB.
Right.
And if you upregulate TFAB, that triggers the
Lysosomal proliferation.
Yes,
The mTOR pathway is actually recognized as increasingly important. There are a number of diseases where it's malfunctioning. But as you say, TFAB turns out to be the transcription factor that's really the key to triggering lysosomal proliferation.
right.
So in addition to trying to help redress the imbalance in fuel supply, you're also trying to say, can we expand the lysosomal compartment so that we can cope with this extra load?
So there are a couple benefits to being ketogenic if you have Pompe disease. It's not only that you don't produce glycogen anymore, you also are triggering the proliferation of the lysosome.
Right, so you're trying to just remove those ineffective attempts to
Yeah.
mobilize glycogen,
Yeah.
and by supplying an alternate fuel, but also it may be that it's beneficial to trigger this signal to lysosomal proliferation. So those are at least two potential mechanisms. There may be more.
Yeah, which will benefit ERT and its capabilities.
Exactly.
Be good. Well, thank you, Dr. Patterson. appreciate your time, and thank you for everything you've done for
It's a pleasure.
us and Leo and the foundation.